Good afternoon. Today I will be taking the topic International and National Health Agencies. The contents are introduction, international agencies, the World Health Organization, other United Nations agencies, nor governmental and other agencies, other international agencies, Indian voluntary health agencies. Now the introduction. Nothing on the earth is more international than the disease, said the Paul Russell. In order to protect against the spread of the disease from one country to another, many attempts were made in the past by the individual rulers and the states to place the barriers against the international by the detection and isolation of the incoming travelers. Now, the international agencies are the World Health Organization, United Nations International, Children's Emergency Fund, United Nations Development Programs, Food and Agricultural Organization, International Labor's Organization, Cooperation for the Assistance and the Relief, everything. In the National Health Agencies, Hind Kush Nivaran Sangh, Indian Council of Children Welfare, Tuberculosis Association of India, Bharat Sevak Samaj, Central Social Welfare Board, the Kasturba Memorial Fund, the All India Blind Relief Society, professional bodies, Child Welfare and Holistic Organization, International Agencies, Rockefeller Foundation, Pan American Sanitary Bureau, the United Nations Relief and the Rehabilitation Administration. Objectives of the health agencies: control and management of the epidemics and the communicable disease affecting more than one country, exchange of the health information and experience at international level, helping and assisting underdeveloped countries in training the health staff, medical planning, international health in case of disaster, and also for the control of the drug addiction. Another international health agencies brief: World Health Organization. The birth of the World WHO, the World Health Organization, had its origin in April 1945 during the conference held in San Francisco to set up the United Nations. The representative of the Brazil and the China proposed that an international health organization should be established. The constitution was drawn up at the International Health Conference in New York in 1946. The World Health Organization is a specialized non-political health agency of the United Nations, headquarters at Geneva. In 1946, the constitution was drafted by the Technical Preparatory Committee under the chairmanship of Rennie Sand. Approved in the same year by the International Health Conference of the 51 nations in the New York. The constitution came into force on 7th April 1948. World Health Organization scheme is chosen each year to focus attention on specific aspects of the public health. The main objectives: the attainment by all the peoples of the highest level of the health, which is set out in the preamble of the Constitution. The current objective of the WHO is attainment by all people of the world a level of health that will permit them to lead a socially and economically productive life. WHO is unique among the UN specialized agencies in that it has its own constitution, own governing bodies, own membership, and own budget. It is a part of, but not the subordinate to the United Nations. Two major policies developed are the influence the WHO, the Amla Ata Conference's 1978 on the primary health care, which provided both WHO and the UNICEF with a common character for the health. The global strategy for the health for all by 2000, and more recently, Millennium Development Goal. Membership, the WHO is the membership of WHO is open to all the countries. Most countries are member of both the UN and the WHO. There are some differences. For example, Switzerland is a member of WHO but not of the United Nations. In 1948, the WHO has 56 members. WHO has now 194 member states and the 2 associate members. Work of the WHO: malaria eradications, TB control, control of other communicable diseases, health laboratory services and production of vaccines, public health administration, the rural health services, quality control of the drugs and the medical education, maternal and child health. The structure: WHO consists of the 3 principal organs: the WHO health assemblies, the executive board or the cabinet, the secretary, the World Health Assembly. It generally meets in Geneva in May each year. It is attended by the delegations from all the 193 member states. Its main function is to determine the policy of the organization. The executive board, it is composed of 34 members technically qualified in the field of health. Members is elected for the 3 years. Its main function is to give effect, decision and the policies of the health assembly and to advise it generally to facilitate work. The secretary, it is staffed by the 8,000 health and the other experts and supported staff on fixed term appointments working at the headquarters in the 6 regional offices and in countries. The organization is headed by the Director General, who is appointed for the 5-year terms by the Health Assembly on the nomination of the Executive Board. Regional directors are appointed by the boards with agreement of relevant regional committee. Personnel of the WHO headquarters are appointed by the Director General in accordance with the staff regulation established by the Assembly and arrangement between the Director General and the Regional Director. The function of WHO: prevention and control of the specific diseases, development and comprehensive health services, family health, environmental health, health statistics, biomedical research, health literature and information, cooperation with the other national organizations, WHO regional organizations, regions and the headquarters. The region in the Southeast Asia, Africa, America, Europe, Eastern Mediterranean, Western Pacific. The other United Nations agencies, United Nations, International Children's Emergency Fund, UNICEF, United Nations Development Programs, Food and Agriculture Organization, International Labor Organization, Cooperative for the Assistance and the Relief Everywhere, United Nations International Children's Agency Fund, United Nations International Children's Emergency Fund, UNICEF. UNICEF, the United Nations International Children's Emergency Fund, is one of the specialized agencies of the United Nations, established in 1946 by the United Nations General Assembly to deal with the rehabilitation of the children in the war-ravaged countries. In 1953, when the emergency functions were over, the General Assembly gave it a new name, UN Children's Fund, but retains the initial UNICEF. UNICEF regional office is in New Delhi. The region is known as the South Central Asian region, which covers Afghanistan, Sri Lanka, India, and the Maldives, Mongolia, Nepal. UNICEF is governed by 36 nation executive boards. As in 2010, the headquarters in the UNICEF, the United Nations, New York. UNICEF works in close collaboration with WHO and the other specialized agencies of the United Nations.